major concerns with the shutdown?
Gosh, they're huge. It did need to happen. We literally asked the government to be funded last Wednesday, just like it was last Tuesday, in an effort so that we can complete the budget, the appropriations process, which is what government should do. They should have budgets. That's how they should work. That's what the American people want. To be able to get us through November when we should be through the appropriations process. So we literally asked for the government to be funded one day to the next. Sadly enough, progressive politics have gotten hold of the Senate, and they voted not to fund the government, which has so many correlations. Not paying our military, our parks are not open. The IRS has put down a lot of folks. I mean, taken a lot of folks off. HHS is a lot of folks not there. Departments of education, same thing. Multiple agencies are now not functioning for the American people, literally because of progressive left politics.
And that kind of goes into my next question because you did bring it up. But what is your stance on suspending pay for federal employees, especially military members, as you said? And so we'll get into
that. Well, look, I hope they get paid. I hope I'd love us to not shut down the government tonight, and so they can get paid and not miss a paycheck. Our federal workers are the backbone of our government, but this again was done for political reasons, and they are the collateral damage.
Right, and with ENC having such a big military population, do you have a message for these active members and their families?
Yeah, look, I'm sorry the government shut down. I don't want it. I didn't vote for it. They have become pawn in progressive politics, and it is a tragedy. This is a national embarrassment, and it's a national tragedy.
Right, and that goes into my next question, which is something about concerns regarding illegal immigrants being paid through tax money for health care. Can
Sure.
you just talk to me about your Republican colleagues saying one point of contention is due to Democrats wanting illegal immigrants to have health care paid for by tax dollars?
Yeah.
Do you agree? What is your stance?
Yeah, you mean, do I agree that illegal folk, or people here illegally should be
do you agree
given
with
free
your
health care?
Republican colleagues?
Yeah, it's very interesting if you go back and look at when the Democrats actually did have primaries for presidential nominees, and Biden and several up on there, and the news reporter asked them which members would have health care paid by taxpayer dollars for illegal aliens. Every single one of them raised their hand. So it is a progressive, and at that point it becomes mainstream, a Democrat talking point. Look, I'm a physician. I've been a physician for 35 years. I want everybody to take care of being taken care of. But when you flood the country with 13 to 20 million individuals, depending upon what you look at, you don't know who they are, where they're from, where they're going, why they're here, and you ask the American people to pay for their health care as well as many other benefits, food stamps, et cetera, it's not fair. It's not right to ask that of the American people.
Right, and one of the questions we got from people, because we opened this up on a Facebook post, and I went out and asked people what they would want to ask
Sure.
you. And one of the main questions that I got was, are members of Congress being paid during the shutdown?
No, I said no. I was the first one in the state. I sent forth a letter saying I'm not going to take my pay. The 27th Amendment says that that congressional pay cannot be changed during that term. It has to be effected to the next term. So I basically said I'm withholding my pay.
So the next question I have is, what do you think it will take to end the shutdown, and what is a compromise that would have your support?
Yeah, so the crazy thing is we didn't ask for anything. We literally said, hey, fund the government Wednesday just like it was on Tuesday. The same thing that Chuck Schumer and 6 other Democrats, 8 Democrats voted for last March. We didn't ask for anything. We just asked that we be able to continue the budgetary process. What have they said? They've tried to ransom the government for a spending package of $1.5 trillion, taking back all the things that were done in the reconciliation package. Remember, they did their reconciliation package with the Inflation Reduction Act, which was said to have cost $300 billion, ended up costing $1.4 trillion. Reverse all the stuff, take away the $50 billion that we have supplied for rural health care transformation, and so many other these nonsense DEI initiatives, transgender plays in other countries, all this other absolute progressive nonsense, ransomed to basically open our government again and pay our soldiers. Sorry, there's really not much to talk about. This is ridiculous.
Right, and sorry, I'm a little lost in my questions.
Sorry.
There we go. So one of the other questions we got, in addition to the concerns with healthcare tax dollars going to healthcare for illegal immigrants was also concerns from people about delays with Social Security and insurance. Can
Yeah.
you just talk to me about, how you feel and how maybe you can quell some of these concerns?
Sure. Again, collateral damage, things that just never needed to happen. Social Security checks will be going out for the foreseeable future. The WIC program, the Women and Infants and Children program, runs out of money in about a week and a half. So that's a huge program for impoverished individuals, especially mothers with just children, on how they get their food. This is huge. It's terrible for those who are impoverished in our nation. This doesn't need to happen. Chuck Schumer can literally just end this tonight, vote for it, and let us go through the process. We can have a discussion about health care, and I'm sure you have another question about that, about the premium tax credits, and I'll let you just answer that question, ask that question.
So yeah, with the premium tax credits, I believe there is a grace period for people to sign up,
Yep.
and that's kind of been halted with this shutdown.
Yep.
So with concerns regarding that, what would be your response?
So I think people need to understand what the premium tax credits were. They were a temporary COVID era subsidy to go to people to pay to health care. Now, I think both Democrats and Republicans would be outraged to understand that people in some places who make up to $600,000 because of these premium tax credits would get subsidies for health care. That's absolute nonsense, but that's the way they wrote it. Second of all, they lowered some premiums literally down to zero for people. That's why we have Medicaid and just for the small amount there. So people were taking advantage of that. And here's really what is horrible, that depending upon what you read, what institute you read, anywhere from 13 to 25 million individuals have come onto the exchange and have never filed a medical claim in the entire time. What does that mean? Are they super healthy? Perhaps a couple, but doubtful. What is thought that this is widespread fraud, that people were enrolled either without their knowledge or data was made up data made up falsely by insurance companies. Because remember, the checks don't go to the patient. They go directly from the federal government to the insurance company. So we know that hundreds of billions of dollars have floated out of the federal treasury to insurance companies literally for no reason. So they're claiming now, if we get rid of the premium tax credits, that premiums will rise. If they rise, the only reason they're going to rise is because of large corporation insurance company profits, period. So if you look at what's happened since the ACA came in, the Affordable Care Act, look at what happened with insurance company profits after that in 2014. What do? They went skyrocketing. What's happened with premiums? How about that? They followed the same track. So we're paying a lot more for health care since the ACA, and we're paying our insurance companies more. So if you hear the things, your premiums are going to go up, guess where they're going to go? They're going to insurance companies. They're not going to the people who deliver the care.
Right. And one of my last questions is, would you have a message for your constituents in North Carolina's 3rd District?
Yeah, I think this is tragedy. I think it's a national embarrassment. 13 times during the Biden administration, we funded the government. We did not have a shutdown. Republicans went in and said it was more important to fund the government over policy problems. Well, now the progressive left, as we can see, look at what's happening in New York, has taken a stranglehold of the Democratic Party, and patients, members in our military, women and children are now the collateral damage of progressive politics.